Have you ever taken a medication that didn't work and maybe even caused symptoms? Have you ever taken an herb or a supplement that didn't work and maybe even caused negative symptoms? Have you had the opposite experience? Have you taken a medication that worked beautifully and had the intended clinical effect? Or have you taken a supplement or herb that worked perfectly and had the intended clinical effect? Regardless of which scenario you've experienced, and you've probably experienced both, the result, whether it's a negative or positive result, tells us a story about your physiology. And this is a story or a clue that we should pay attention to. Is your doctor paying attention to these clues? Are you paying attention to these clues? If you take a drug or a supplement and you have a negative result, then the important part of that is to take that as a clue and dig into the underlying physiology and the pathways that that drug or supplement affects, and ask, why is pushing that pathway causing a negative effect or symptoms? And vice versa, if you take a drug or supplement that works, that is impacting a certain pathway or a certain physiologic process, and asking the question, why is that working so well, and diving into what parts of physiology are you pushing with that drug or supplement to help you achieve the clinical goal, helps you understand how you can do that better in the future. And if you're taking a drug and you're getting the benefit, then learning the pharmacology and saying what pathway is that pushing to help me helps you determine whether or not you could use a natural substance like an herb or supplement or nutrition to push the same pathway and eliminate the side effect profile associated with the drug. So whenever you undergo treatment with any sort of doctor, or you use Dr. Google and do it yourself, if you have a negative result with a drug or supplement, or a positive result with a drug or a supplement, you want to understand the physiology, and particularly with the negative results, understand, why did that not work for me? Because it may not be that that drug or supplement is bad for you. It may be that you have an underlying physiologic dysfunction that you need to figure out and ultimately correct.